Yo, yo, yo.
There you go. What's up, fellas?
What's up? What's up?
What's up?
I'm trying to get more lighting.
Oh, okay. And let there be light.
I know, right?
Oh no, everything's messing up. My whole camera system messing up.
What's up, fellas?
What's up? You think we had this down pat right now? We're actually live right now.
Yeah, we good, man. We good.
Let me figure out what's wrong with my camera. Oh,
Happy MLK. Happy MLK.
Thanks, man. Same to you. How y'all been?
Man, we good, man. We good. We good. My wife, I love the fact that you try to get my wife on here.
I tried.
She was like,
nope.
I was like, we're gonna get you on here one day. So I told her, just make a nice brief cameo, like,
right.
You know,
just walk past.
Just walk past, and that's it. Yeah, I'm gonna try to get her on here one day, man. But I appreciate that. She was tickled by that.
All right, this is crazy.
My
light is gone.
What up, CC? I'm trying to figure out what's going on with my camera right now. I don't.
Yeah, she told me I got to get more. I got to be more loose.
Loose? What's that? What you mean by that?
Like, man, you're being too proper on there. Why don't you with your homeboys? Why don't you just get loose? I was like, you know what? All right. So I took off my tie. You know, I took off my bow tie. I'm on here. I'm ready.
Oh boy,
I'm gonna be a little loose today, man.
You be a little loose.
Yeah.
I'm trying to figure what is going on with my computer. If it ain't one thing, it's another.
Mm-hmm.
Hey, Carbon.
Oh, you see folks in the yeah. The folks are coming in. Yeah. Okay, cool.
Yeah. I mean, you know, we battling that football championship too. So
that too. Yeah.
CC, say you look relaxed now.
Who? Me?
Yeah.
I am relaxed. Yeah, there you go. Thank you for acknowledging. My wife told me I gotta be more loose. Long day today, but it's good.
My camera pops in and out. I'm like, what is wrong with my camera?
Don't nobody want to look at you.
Hey, I can live with that. Y'all don't need me anyway. Y'all don't need. What is up with my camera?
Thank you, CC.
All right, Carbon, don't be mad at me. I'm trying to get some more light, but all my light disappeared.
Okay, so my camera now. I don't know I'm gonna have to restart. I'll worry about my camera later. It's all about y'all anyway. All right, so I'm slowly but surely learning all of this now. So this is I'm a hot mess right now. I'm a hot mess. Okay, so.
Hey, you know, we're real official with that disclaimer, just that tagline just going right across.
I know, right? It's legit.
I'm just like, okay. Oh, that's us. Okay.
If it ain't one thing, it's another.
Okay. I see what you're saying. I don't want to see Eric. I don't want to see Eric. I've seen him my whole life. I can be fine with that.
I am trying. I have no idea what is wrong with this. I know. Well, my kids touched it earlier, so. Yeah, I know I'm gonna have to restart the whole thing. You know, what it is. Y'all seen me enough times. I'm always on the Instagram videos anyway. So it's about these two guys. It's about these two guys.
Let's go ahead and start it. What we got? Let's go. We still got to make up for last time. We missed.
There we go. We didn't
cover part of the last one.
Okay, so here we go. So it says, in this live, we'll explore everything you need to know about the thyroid, an essential gland that influences your overall health. From understanding its function to recognizing symptoms of thyroid disease. This live is designed to provide you with actionable insights and guidance for maintaining optimal thyroid health. So these are the things we're actually going to cover. We're going to jump back to what we covered last week or last live, but this is what we're going to learn. We're going to dive into it. Understand what the thyroid is, the common thyroid diseases. We have hyper and hypothyroid. Hypo is underactive, hyper is overactive. Yep. Symptoms to watch for. So if you're suffering from one or the other, these are the symptoms to actually watch for. diagnosis and treatments. We're going to talk about TSH, T3, T4, and that's right up your alley when it comes to that part. Thyroid and weight loss, because we know about if you're hypothyroid, weight loss is going to be a little more difficult. And we're also going to talk about what happens if somebody's thyroid is actually removed altogether. That's one of the biggest things. Somebody hit me up and say, hey, my thyroid, I don't have my thyroid anymore. So we're going to hit that as well. A nutritional support for thyroid health, lifestyle tips for better thyroid function, scrolling on down, and key takeaways. So we did create a study, won't say a study guide, but we did create a form for you all. So that way you can follow along. You have questions, you can actually look at that, refer back to that as well. So key takeaways. So by the end of this session, these are the things, as y'all are watching, these things you should be able to gain a clear understanding of how the thyroid works, because that's very important for us. Knowledge of the common thyroid disorders and their treatments, practical tips, not trips, practical tips for managing symptoms and supporting thyroid health, and confidence to advocate for your health and seek the care you need. And that's why we have these docs on to help us with all that. So that's what we're going to be talking about. But first, we're going to jump back to our last live. Our last live, we covered so much. Two things we didn't cover was exercise tips for beginners. One of the biggest things when it comes to that is when you go into the gym, let's say like Planet Fitness. When it comes to Planet Fitness, they actually have personal trainers there, and it's free, which is what I like about Planet Fitness. It is free. So those personal trainers will actually work with you all, say, hey, these are the things. If you have any ailments or any problems, this is what I'm working against. Are you able to work with me? And they'll work with you on that. Hey, by your sugar garden. See, and I was in Louisiana. You weren't even there. You moved to Arizona. You done hurt my heart, but it's all good. So one of the common things is you want to go into higher reps when looking at weight loss. You're talking about anywhere from 12 to 15 reps or even all the way up to 20 reps. That's your higher reps for your weight loss. When you're looking at actual strength, you drop that down to about 12 reps. And then from there, you even drop it down even more. We look at hypertrophy or building up those muscles, anywhere from 8 to 10 reps. So that's that part. What I do, I would definitely drop that into YouTube. And for those that are actually watching, Dr. Coy is available as well as personal trainer. So if you have questions, feel free to hit us up on that part. So sorry we couldn't cover that last time. We ran out of time, but that's a little bit with that. I would definitely drop some of that in our Instagram. If you want to hit us up on the email, info@whitesidetacticalsolution.com. We'll help you out with that as well. So with that said, jumping straight into the thyroid. Again, jumping straight to the thyroid. Biggest thing, what exactly is the thyroid? So with that, thank you, CC. So what exactly is the thyroid? So can y'all tell us what exactly is the thyroid and how important is it?
I'll let you go, Coy, if you want to go first.
Well, the thyroid is a gland in the neck area, the cervical area, and it is mainly responsible for delivering hormones. I just look at the thyroid as the gas pedal to the car. It gives you the metabolism, it gives you your function, and it gives the hormones that really help the cells to generate the energy to create the function that they're designed to have. And so the thyroid is very, very important to one's metabolism, to one's brain function. Every single part, every single cell of the body has thyroid reception because it's going to give the metabolism that cell needs. Go ahead, Doc.
Yeah, I agree with it. And a lot of people they think of the thyroid being high up. It's actually lower down on the neck, almost near your collarbone. It's in that area. The other thing is people really don't think about the thyroid, but the thyroid is a very small gland that has a significant function. Like Dr. Coy said, it is pretty much the gas pedal for the body. If the thyroid is overactive, the body revs up. If the thyroid is underactive, the body slows down. So a lot of times in my population, I will do lab work to check the thyroid if patients are complaining about specific things. If they're saying that they're having trouble losing weight, despite the fact that they're doing everything they're supposed to. If they have cold, constipation, just dry skin, their hair is dry, it's brittle, the nails are brittle. I'll look at the thyroid just to see how that's functioning. There are some people who said they're extremely hot, just hot for no reason, or they feel palpitations or fast heartbeats in the heart. Then I will check the thyroid from that standpoint as well.
Yes, it's a very unique gland. You know, just like that picture that you saw, it looks almost like a butterfly. And oftentimes when you go to see the doctor, you know, if it's a very thorough doctor, they're doing an inspection and looking at you, and they'll look at your neck. And sometimes, you know, when you can see the neck, and sometimes it can look either swollen, or when they palpate around the neck, you know, they'll feel around that butterfly, around that area there. And sometimes you can kind of see that, that there's some swelling there. And if they can sometimes feel that there's some nodules there, they can feel that tissue is enlarged. That's gonna send some signals to that doctor to say, hey, we may need to do some diagnostic testing, or they may ask you some questions based on your symptoms. Sometimes you may not even know you have an enlarged thyroid or a thyroid problem. And if it's a person or a doctor that is very keen on their inspection, you know, they'll be able to point out some things with that.
Yeah, I got you. And so let me see. Oh yeah, I see what you're saying, Bayou. Yep, I actually know several people that had that thyroid removed, and it's actually weird. Some people are symptomatic, others are not. For me, as a physician, what I look for is when people come in, I sit down and actually take the time to get to know what's going on, what is their specific complaint, and how are they being negatively impacted. From there, I'll do a physical exam. If your doctor doesn't touch you, get another doctor, to be honest, because that's what you're there for, is your doctor put hands on you. If it's looking in your ears, you're feeling your throat, listening to your heart, your lungs, that's something they should be doing. But for me specifically, I will feel around the neck and actually walk behind the person so I can get a better grip. And I feel down in this area. That's where the thyroid is. And I'll feel one side, then I'll feel the other side, and I'll palpate both of them. What I'm trying to feel is, do I actually feel the thyroid? Can I feel it? Because technically I should not be able to feel the thyroid. It's supposed to be that small. The other thing is, if I feel something, do I feel a nodule? Does it feel funny? Does it feel large? But also, in addition to that, what I'm doing is, when I'm feeling the thyroid, I'll walk around, I listen to your heart, I look in your eyes. I'm actually looking at the size of your eyes, because there are some people, we'll get to it later, they could have possible what is called Graves' disease. And that's overactive thyroid, and the eyes is actually bulging out. And there's actually a true way to measure how far it's bulging out. But for me, if the eyes for me is not recessed inside the head and is slightly bulging out, I will go ahead and order thyroid lab work just to see if there's something that's abnormal.
Yeah, it's very, very small gland. You know, it's not very large, but you know, it has a large supply of blood there, because, you know, it's there to supply some metabolism. And when we talk about metabolism, we're talking about like your basal metabolic rate. These are terms that are often said to how much calories your body's able to use, you know, and you know, what keeps your body running pretty much, and how you're able to generate your energy, how you're able to consume your oxygen, and just how your body's able to function. This is essential for growth. This is essential for metabolism. This is essential for development. So very, very important gland.
Yeah, and then the other thing is, looks like Eric pulled it up. It's just common thyroid disorder, hypo and hyper.
Yeah.
So hypothyroidism is underactive. It's working slow. It's everything is slow. Basically, that's the easiest way to define it. So if you think, what does the body really do? Well, think about your body slowing down. If your metabolism slows down, you're not burning as much energy. Like I said earlier, you're going to be constipated, because the thyroid is helping with the function of the body, would get your bowels to move, to get the crap to move out of your body. So everything is slowing down. And hyperthyroidism is overactive. It's revved up on full blast. And those people, like I said, you'll see the eyes, but also they'll be anxious, nervous, jittery. and you're trying to get an idea, and the person typically says, I have not been like this, I don't know what's going on. They can feel palpitations in the heart. So those are really the main difference between hypo and hypothyroidism. What comes down to it is really the treatment plan. How do you diagnose it and how do you treat it? That's the biggest difference between the two.
Yeah. I mean, when you look at both of them, and for me as a functional medicine practitioner, I'm always looking to the root cause of these issues. Symptoms are just signals. Symptoms are roadmaps to let you know that the body is actually not well. And so when you look at both of these, these signals, they're very polar opposites. When you talk about hypo, again, low. When you talk about hyper, it's high. And when we look at hypo, like those comments there, I think we got that. You probably have to hit that that X there so we can see that on the screen there. Can you click on? Yeah, there you go. Yeah. So, when you're looking at hypo, yeah, you're seeing people are struggling with numerous symptoms. The weight gain, inability to lose that weight. And this kind of hits home because, a lot of these things, especially from a female standpoint, the thyroid issues, typically majority of these hypothyroid issues happen with females. Majority. Not to say that males can't have it, but I've seen it with my male counterparts, but majority is going to be with females. And usually I'll see these things come up in at certain time frames of a certain of a female's life, milestones of the female's life. It could happen at puberty, as early as puberty. It can happen around a major car accident. We talk about like the neck, right? Like, with whiplash or major traumas, physical traumas, but car accidents, any type of sporting event or something like that involves the neck, significant physical damage there. It can also happen after a major traumatic event, like an emotional, mental trauma. These things come about with that as well. And this also can happen around perimenopause. So depending on a female, depending on how long they've lived their life, a female lives long enough, they're going to have to go through that phase of life called menopause, right? And when that occurs, these symptoms will pop up. And sometimes it can oftentimes be just missed or just dismissed, thinking that, it's nothing. But one of the things that we see is like that picture showed, it will be, persons, despite them going to the gym, they're having difficulty losing weight. The person, the female is having lots of mood swings, not even knowing why. Like they just think that it's a female thing. And they're oftentimes missed and misguided there. It can also be with, like we talked about, constipation, just puffiness, feeling bloated, issues with digestion, all these factors, irritability, depression, slow heart rate, joint pains, all these brittle nails, like all these things that make a female pretty and they show signs of beauty, it starts to wither away. And we'll talk about these even further and how this even relates with your immune system. But these are just some key symptoms here: fatigue. These are happening on both sides. But then if you go to the hyper side, they lose weight without even thinking about it. And even sometimes they're losing muscle. They're losing the strength of their nails, losing issues with brain function, just having that anxiety and just hyperactive heart rate, all these things. And so on the hypo side, they're having difficulty going to the bathroom. Hyper side, I mean, everything's just, no matter what, it's coming out, right? And so these are some major symptoms that we have to make sure that we differentiate. And the signs and symptoms are just signals and signs that, hey, the body's not balanced.
Yeah. And then the other thing, like Dr. Coy was saying, we don't know why thyroid problems occur. It's largely unknown to the medical community. The thing is, we know that usually about 1 in 8 women, 1 in 8 women tend to have thyroid issues. And then as they get older, we know it's more prevalent in the older population. The American Thyroid Association, they estimate that about 12% of the US population will develop some type of thyroid condition at some point in their lives. We don't know why it affects women more than men. That's a study that's still ongoing, but we just don't understand why that's the case.
Mm-hmm. And, and here's the thing, from my standpoint, as a functional medicine practitioner, is that when a female is walking in to their doctor because they're having these symptoms, they're having issues with thinning hair is not as strong, they're thin, they're having issues with their skin, they're having issues with their weight gain. And it's very sad, because oftentimes when you go to the doctor, the traditional medical model will choose to take every symptom, and for every symptom, put in an algorithm and give a medication. And if the labs, when they do the lab testing, if the lab testing show that some markers like TSH and things that we may talk about in a few moments, if they're off, meaning that for a hypothyroid patient, their TSH is going to be very, very high, right? And it's the opposite of what we may think, but it's the TSH, which is a brain marker. It's really not even a thyroid marker. It's just showing the amount of stimulation that's going on. If that's high, then they'll prescribe a medication to bring it down. But it's still yet not really addressing the symptoms. Sometimes the symptoms will kind of go away a little bit. Sometimes they just stay the same, or even sometimes they get worse over time. And even though they may pull the labs, and a lot of times they'll just pull just minuscule labs, but they're not really looking at the why. Like what Doc's saying is that we don't know why, but why these things occur. But a lot of these things come about with the immune system. And this is something that is where I see where patients are suffering from this, because this is an issue that 80% of thyroid patients will have an autoimmune condition. And the thyroid is actually being attacked by your own immune system. And it's basically the thyroid is these autoimmune thyroid issues. This is the most common autoimmune condition that's there. And when this occurs, this is going to cause these symptoms. This is going to cause these things, and letting you know that, hey, something is wrong. And these are issues that in my office, where I look deeply at, looking at the triggers as to why the body is attacking itself, to bring down that metabolism, to make that thyroid smaller, to destroy it. And unfortunately, if it's not looked at, and from that vantage point, that this is an immune system problem, thinking that the thyroid is the problem, when it's not, it's actually the victim. And so when we look at that, we have to shift our focus. And that's where we shift our focus into understanding that, this is something that we need to address those triggers.
Yeah. And I see.
CC, she was asking, can we ask for a thyroid check? So when you're going in for a doctor, can you ask for a thyroid check, or do you have to actually have symptoms for it?
For me, I actually check it. I check it once a year. I automatically check it once a year. And I will let the patient know, but I actually sit down and tell my patients I'm looking for, or these are the lab works I'm going to order. Where I work, they know that I order lab work because it's about 12 tubes of blood that I'm drawing once a year. And I'm looking for every single thing that I could possibly think might be wrong. Even if the patient is healthy, I'm still going to look. And that my job is to practice preventive medicine. So I want to find stuff ahead of time. So yes, definitely, CC. Go in. Your doctor, I'm pretty sure your doctor already checked the thyroid, did your thyroid function. But if not, tell them that you want it done. You got to remember, you're in charge of your medical condition, your medical health. So you have to let your doctor know, this is what I'm looking for. I'm concerned about my thyroid, or have you done a thyroid check? As simple as that. Typically, the doctors are not going to say no. Yeah. The other thing is, somebody mentioned about the goiter, and the goiter itself is that if somebody comes into my office and I see an enlarged, the neck is thick or is large and it's just in the front of the neck, I'm going to palpate, and I'm going to figure out what the heck is actually going on. Then I'm going to check lab work. If the lab work comes back normal, I'm going to talk to the patient and kind of get an idea. All right, how do you feel about your neck? What exactly is it? Is it bothering you? Because when the thyroid enlarges, it can actually start pushing on the airway. It can actually start affecting your vocal cords and giving you a raspy voice. So I want to see what's really going on. Why is that happening? Because that is not normal. And if it's just completely, let's say, normal for that patient, then I'm going to ask them, do they want to see a specialist to actually have it removed? But we still know if it's enlarged, there's an underlying reason, and there is a cause. The thing is, people kind of get upset with the medical community because they say, all right, you ordered lab work, but this happened so many months down the road. Yes, because the body wasn't presenting at that time. It was not showing up in the lab work at that time. So the body takes time to start presenting things. It'll give us little breadcrumbs. But the problem is that we got to try to pick up all the breadcrumbs and piece them together to determine what's truly happening.
Yeah, and let me answer CC's question from my vantage point. In my practice, I treat this every single day. This is what I specialize in, not only helping individuals reverse type 2 diabetes, but also with thyroid issues. And usually how a person gets in my office is because they've already been diagnosed with some type of thyroid issue that they know that is there, but they've already been through the rigmarole of going to doctors, on medications. The medications work, so to speak, temporarily. Their symptoms subside for a little while, and then it stops working. And they go back into their doctor because they're feeling bad over and over again, and they're not feeling better. They're not getting that energy. They're not losing the weight, even though they're eating well. Their skin is not doesn't have the right moisture, and their hair is falling out, or their nails are getting brittle and thin. And so they're just trying to figure this out. And usually they're just going through this, and really to the point where a lot of times they get depressed because they're losing their beauty, they're losing their function. And unfortunately, a lot of times doctors will actually prescribe antidepressants because they will even say, hey, you're doing well. The labs are saying, those minuscule labs that they run, hey, it's normal. Something must be going on with you. And yet you're going back to them saying, hey, this is a problem. This is a problem. This is a problem. I don't feel well. And so a lot of times when they come to me is, from that standpoint, is I've been everywhere and they're not listening. And when I run labs, just similar to what Dr. Whiteside is saying, is that you got to go beyond the regular lab markers that are typically just more so for insurance purposes. They're not there to help you to rid the issue. Is really to go deeper. And so when I run my labs, lo and behold, it lights up like a Christmas tree. And then we're able to then address it from there.
Okay, so one question was Homestead Rachel. She was talking about she suffered from hypothyroidism for 30 years and she's on meds. And her question is, I really want to stop taking those meds. Now, when it comes to, I know she had to actually go talk to her doctor about that and check on the levels. But what do you, I guess, from an overall, what would be a suggestion?
I love it because me and Corey probably had two different viewpoints about it. Okay, that's what I like. From my standpoint is you're on the meds, you're going to be stuck on the meds. And the problem is that your thyroid is no longer there. So you no longer have that key component in the body to truly function the way the body needs it to function. So you're taking the medicine, which is usually your levothyroxine or your Synthroid, to help supplement what is truly the way your body's supposed to be functioning. The other catch to that is that when you're on that medication is very sensitive. So if you take calcium-based products or iron products, it will actually affect the absorption of that medication, which will then not allow your body to absorb it and reproduce the thyroid function that you should have. So for me, from my training, it's just you're on that medicine, you're on it for life. I have not seen anything outside of that medication that's actually really good. But honestly, I have not researched in full detail to see what supplements are out there.
Yeah. Just like Doc said, I'm on the other side where patients have been on these levothyroxine, Synthroid, and Armor, Thyroid, and all these medications, and yet they're not getting better. And so, way the thyroid works in my eyes, or from a functional standpoint, is that there's something inhibiting your body's ability to generate that metabolism to allow that thyroid reception. And much like type 2 diabetes, where a person is not getting that glucose into the cell, there's something holding that cell back from being able to have that reception or accepting that energy. Same thing with thyroid. And so figuring out what are the triggers, what are the obstacles, or what's the challenges that person is having to hold them back from having the proper thyroid reception. And so, as I said before, majority of thyroid patients will have an autoimmune condition called Hashimoto's thyroiditis. Mm-hmm. And when that occurs, the first thing is figuring out if you have it. And the testing is going to dictate that. The thorough testing is going to move you into that direction. Unfortunately, the traditional medical model looks at hypothyroid and Hashimoto's or autoimmune the same. They will still give the medication and hoping that, well, if it's low, let's get it higher. Or if it's high, let's get it lower, right? Versus really, from my vantage point, is let's get to the root issue. Like, let's remove the triggers. And there are many triggers that come about from this. There could be environmental factors, environmental toxins, things like mold, things of immune system factors, the poor diet, food sensitivities, inflammation, anything that's causing inflammatory processes. These are things that affect your thyroid reception and affect your body. So from my vantage point, if you're able to find out what's missing or why these issues are not connecting properly, that's when the magic works, because you're able to remove that and then allow the body to do what it's designed to do, to heal itself. So that's from my vantage point.
Yeah, no, I agree with you. And the other thing is that a lot of your traditional physicians, and I say that more of your old school, well, I can't even say old school, some of your new school as well, is they only want to figure out, okay, you got this issue, push a pill. I'm not a pill popper. Or a pill pusher. I'm just not that, because you're coming into me for an issue. So it is my job to work with you to determine the underlying cause to fix that issue that you're having. So if that means that I got to have you come back and see me multiple times, then as a physician, I'm going to have you come back and see me multiple times so we can figure out what's going on and we get on one accord. I'm not a fan of the physicians that say, here, take this medicine, just go away. I'll see you back in 6 months, because you're coming to me as an expert. So as an expert, I need to do my job and to manage your care.
Yeah. And I love this question. Can pregnancy be a trigger? Absolutely.
Yes.
Absolutely. So remember this. So remember this again, like if you think about a female, and if you live long enough, there are multiple things that can occur in your lifetime. Like I said, these things can happen. Majority of these thyroid issues happen in women. So we're talking about puberty, It can happen as early as puberty. And this is so let's just be real. Like a lot of these things, when we talk about fat shaming and you see a female that's or a child that's still in their teens, but having difficulty losing weight, but they're still working out or they're still very active. A lot of times we just think that they're just lazy and they're not doing what they need to do. And kids are very horrible. Like, we did it. I mean, we were horrible. We were horrible back when we were younger. And then when we start to learn and understand things, especially for me, I'll speak for myself. I'm like, man, that was not cool, because that person could have had a serious issue and pertaining to thyroid. So it could happen at puberty. It could even happen after the birth of a first child, right? Very traumatic event, with childbirth, right? And so hormones are, raging all over the place. And there's so many other factors that, again, after, a physical trauma, it could happen after emotional trauma, but also happen after around perimenopause. And so if a female's lived long enough, it could happen at 2 or 3 or 4 of those milestones, depending. And that's what I see in patients that have had these issues. I have patients that in their 70s and 80s still trying to figure this out. But when you figure it out, man, they can live their better days because they're able to really address the issues that they've been having for so many years. So there is hope, but you got to get to the root.
Good job. I like all of that. Derek, you're on mute. So,
unmute yourself.
Yeah.
All right. I was like, I'm having a call. Eric, high school again, little chat. So what I was saying is that in pregnancy, you got to remember that you're now you are now taking care of 2. You're not only taking care of you as the mother, you're taking care of the newborn or the child that is in production, for lack of a better term. So it's increasing your body's need for more thyroid hormones. So yes, you can end up having what is called thyroiditis, which is inflammation of the thyroid. Also with the thyroid or with pregnancy, the body is requesting or using up more of your estrogen and why am I going blank? It's estrogen and HCG. Those are the 2 more hormones that are increasing the levels of the thyroid. So your thyroid is working hard. So yes, definitely pregnancy can definitely affect it.
One question. So you were talking about T3, T4, TSH. So when they get these blood labs or lab results back, what exactly does that mean? I'll pull up the chart in a second, but what does that mean, T3? Does the T stand for thyroid, or what exactly does it stand for? Because you have a T3, you have a T4, you have a TSH. So one thing I want to do is, if I can find an actual lab, pull it up, I'll just break it down, because that's one of the important things I stress that to my students as well. Hey, we're going over lab work. I want you to be able to read it, because if you ever get your blood drawn, you need to be able to understand. So if I can find one here, I'm going to search for that. But if I can find one, I'd like for y'all to break it down, but I'll pull this chart up. But can you explain T3, T4, and TSH?
You want to call? Yeah, I got it.
Yeah, I can fill in. So, so TSH, I'll just talk about a few markers and we can go through it. So, when we talk about the thyroid, typically, when I do my panel, I do an extensive lab panel on that. And so I would look for, obviously, TSH. TSH is short for thyroid stimulating hormone. And that's really basically the brain telling the thyroid to stimulate thyroid hormone, right? And so, and when we talk about how the body creates these hormones, it's a cascade of different types of hormones that help the cells to be able to operate. And so, typically, like T4 is a hormone that is delivered, and then it breaks down into T3. That T3 is more accessible to the cell to be able to use it for the metabolism and things of that nature. But the thyroid creates majority of T4. T4 is not it's not overly used. It's there to be used, but it's there to be broken down into what's called T3 to help the body to create that metabolism.
Yeah. Let me make sure. I couldn't figure out if I had myself on mute. I had to look around to see. So yeah, if you're looking at it, just like Dr. Coy said, your T4 is the inactive form and T3 is your active form.
Right.
When I order lab work, I actually do only three lab works: your TSH, your free T4, and your free T3. When I look at the breakdown of it, I literally look only at your TSH and your free T4, because if your TSH and your free T4 is off, that already gives me an idea of what's going on in the body. If one is up, the other is down, it's telling me what's going on. So typically the normal thyroid, or first of all, let me back up. So when we do lab work, every lab company has different parameters. So what Coy or Dr. Coy uses for thyroid parameter might be different for that lab company, might be different than what I use, but it's still within that normal range. The other thing is that, and somebody said it earlier in the chat, I don't treat every person the same. Every individual is different. So their body will respond differently to medications or different illnesses that affect them. So when I'm looking at the thyroid itself or the TSH, I'm looking for a range of 1 to 3. That's what I like. It's just 1 to 3. If they're below 1, that's telling me that something's going on. If they're above 3, that's telling me that something's going on. But that's just my preference. My older population, I can let them go up to about 4, almost 5, but that's letting me know that they start going up into hypothyroid territory. When you're at a 1, but you start to go below 1, that's telling me that you're going to a hyperthyroid level. But I look at the TSH and I look at the free T4, and it's hard to give you an example from my standpoint because I want to see what the level looks like, but I also want to see how the body's doing, because somebody could feel perfectly normal and their levels are off, or the perfect person could feel completely abnormal, but the levels are normal. So I have to figure out what my results are based on how the patient's feeling.
Yeah. So I love this chart here because it helps us to look at when you're looking at labs. This is labs 101, from a functional medicine standpoint, that again, from my vantage point, I'm always looking at finding the root cause of it, knowing that these statistics show that the likelihood of a person with a thyroid issue is going to be an autoimmune issue. So I'm already shooting for that. I'm already looking for that and looking at, okay, what is happening with the body? And so we look at these basic markers like TSH and T3, T4. Free T4 is just basically a marker that shows how much of the T4 is available in the circulating in the blood to be able to get from the blood into the cells. T3, same thing. Reverse T3 is actually a marker that's really showing that the body is actually being deactivated. That active T3 that you need is actually being deactivated, and that's not good for that to be out of range. And then we also look at, for me, is also looking at, well, there are autoimmune markers that are often missed in regular panels because most doctors, they'll just run maybe 1 or 2 markers on it. For me, I run no less than 12 of the markers on the thyroid because there are so many other factors behind the scenes that will be pulled from it. And so the standard reference range, that is basically a range that's developed from the lab in that geographical area. So it's going to be different for me in South Florida, for a person maybe in Las Vegas. It's going to be a difference. The standard reference range is going to be different from New York to a person in Arizona. So, these ranges oftentimes will be different, right? But then the optimal range, that's what I look for because that does not move. Right. And it speaks to optimal range. Optimal range is a lot more narrow. as a narrow numbers. And it actually speaks to that the body does not have to be outside of those reference ranges for you to have a symptom. Just like I don't want to wait for, the pipes to burst in my house. If I see a leak, I need to jump on it, right? It could be a major problem. And so the key is these optimal ranges really speak to what the body needs to be optimal. And that's a grading system that everybody should be graded against. And we know that if you're outside of those optimal ranges, there's a problem. And that's basically like one standard deviation away from normal, right? So, this is a grading system. And sometimes, doctors miss this because they're so narrow-minded on the reference range, and symptoms are going off, right? And those optimal ranges, as you get outside those optimal ranges, next thing you know, it helps answer some questions. It helps you to dig a little deeper into it. So that's something that you have to really look at. A person can have a goiter, they can have all these symptoms, but then yet still in the reference range. And that's where the negative issues come about with a person, because then, they're thought to be crazy, or you don't know what you're saying. It's all in your head. There's no way. The labs say they're normal, but really they're not.
So the other thing is, I like it when you say that, but doctors are not paying attention. Well, some. I won't even say doctors. The medical community might not be paying attention. You're looking for a trend. That's what I'm looking for. If you're normal this time, normal, is your normal going down? Is your normal going up? That's what I'm looking for. If your normal is straight in the middle, I'm okay with that. But if I see it trending up or trending down, that's for any of the lab work. That tells me something is going on in the body, good or bad. It's telling me something is being stirred up in the body, and that's something I need to start investigating. So I want nobody to say, well, my friend's level is this, but my level is that. You're also not the same as your friend. Your genetics is different from your friend's genetics. So I like people not to always compare themselves to the next person, because that's not fair to them, and that's not fair to the next person, because everybody's body is different.
Absolutely.
All right, so this question says, what are your views on relation to iodine and salt with thyroid? Because you talked about goiters and things of that nature. So we know the iodine deficiency. So she was talking about, what are your views on that? And then another one, Homesteader, when she pulled up, she talked about she has an iodine allergy. So if you have an iodine allergy, are we more susceptible to having those thyroid problems, or what? Can you tackle both of those questions? Sorry.
Yeah. So one, let's jump on the iodine. Well, just iodine in general. Right. So iodine, if you're looking at an iodine allergy, somebody might have an iodine allergy when they get a CT scan, because when we run certain scans and we're looking for it, the amount of iodine that's in the contrast is a lot higher than the amount of iodine that is in salt. The other thing is, iodine deficiency is actually very rare in the Western community because we iodinize our salt already. So there's already a certain amount of iodine that's in all the salt. I have not seen, actually, there is a couple of iodine-free salt that's out there, but for the most part, all the salt it has iodine in it to prevent the thyroid from being negatively affected. So if that makes sense, that's kind of covering both of it. Now, the amount of iodine that's in salt is a very small amount. I won't say it's insignificant, because it's significant enough to make sure that the thyroid is functioning appropriately in a healthy community. But it's not, I'm trying to even think of the numbers, because I don't even know. I would actually have to look up the number of how much iodine is actually in the salt itself. So I'm not sure. Let me look that up. I'm curious. What you got, Dr. Coy?
Yeah, I mean, the with iodine, obviously it's important for the thyroid to create the thyroid hormones. And oftentimes when a person is diagnosed with hypothyroid, sometimes it's often just, it's automatic that, okay, yeah, you must have an iodine issue, or you have low iodine. And that's not really the case. When we look at underactive thyroid issues, again, the majority of it is going to be on an autoimmune issue. It's going to be more of an autoimmune condition side of things, not so much of it being a dietary deficiency. And if it is a dietary deficiency, oftentimes it's going to be something that, again, that's blocking that. It could be issues with toxins. It could be issues with infection. There's going to be issues that's driving that metabolism down. And so for me, it's really looking at the underlying causes versus just saying, okay, yeah, it's an issue of conversion of iodine. So we have to look at that. We know that iodine is very important for the synthesis or the generation of thyroid hormones, but it's really based on how the body is able to create that metabolism, or what's holding that body's inability back from what's holding the body back from creating that metabolism.
I agree with you on that. I'm sorry, I was looking at the research. So looking at it, most of your specialty salt, so I'm reading it straight from off the internet. Your sea salt, your kosher salt, your Himalayan salt, those are usually not iodinized, which is right. That makes sense. And then most of the salt intake in the United States comes from processed foods, which are often non-iodinized salt. So that makes sense to me as well. Okay. So sorry, I had to just figure that part out. So yeah, sorry. Corey answered the question already for Bayou. And if he didn't, let us know so we can go back over it. And in Homestead, I see what you're saying is you can't do contrast nor eat shellfish. You are correct, because the amount of iodine in shellfish and also the contrast itself is enough to pretty much go put you in anaphylaxis, if not kill you.
Wow.
All right, so jumping back to the T3, T4, and TSH. If you take a look at the screen here, this is what they were talking about as well. This is what both docs were talking about. Can you all break this down? Because one thing you said is that on result 3, the Hashimoto or something of that nature.
Hashimoto.
Yeah. Y'all know that's above me. That's foreign language for me. Could y'all break this down? Make sure that our viewers understand this, because I'm trying to find an actual lab so we can actually break it down. But can y'all break this down for us real quick?
Can you zoom in? Zoe got his glasses on. I'm sure he still can't see it.
Yeah, man. Yeah. So it's probably a lot to go over. But one of the things that what this shows is breaking down the different patterns of what function or the levels of function a thyroid patient will have. And so you'll see these markers like TSH, T3, T3, free T4, and also TPO, which is thyroid peroxidase, thyroid peroxidase, and also TG, which are thyroid globulin antibodies. And so these are antibodies that are attacking the thyroid, trying to destroy the thyroid. And so these are basic markers, and these are just a few of the markers that I would run. But there are also other markers that you need to also take into consideration, because there could be issues with how the body is creating the thyroid hormones. There could be issues pertaining to how the body is creating, how the conversion of T4 to T3. There could be other factors that are pertaining to the body's inability to have that reception. So these are all these factors that come along with that. And so when you're looking at result 1, for instance, interpretation, normal thyroid unless symptomatic, you see all these normals at the top here. These will be normal. And again, you got to look at, okay, well, normal in reference to what? Is it the reference range, or if it's the optimal range? And so you see these normals at the top here, result 1, and then you'll see TPO antibodies negative. So again, if the person is not having a symptom, no problem. There's nothing for you to complain about, right? But then if you go to number 2, it's saying interpretation is essential hypothyroidism. And that's really going to look at this is where the Rubik's Cube starts to come into play with
Yep.
with thyroid, right? You have these different combinations, and this is just a few, right? So you see TSH being normal, but free T3 is low and free T4 is low. And then you see a plus minus on these antibodies. That means that it could be positive, it could be negative. And so here's where we talk about, all right, well, there may be some symptoms that come about from that person. And then you start to see, okay, where is from the brain all the way from into the circulating system, all the way down into the cell. So there are multiple stations, or I would say what you call them, checkpoints in the thyroid, from the creation of the thyroid, the stimulating of the thyroid, all the way down into the cell. So not to get, because this can really get confusing here, but there are multiple combinations here. And if you see the combination, or the combination that where you see the certain markers are off, it's key that your doctor is able to really look at those specific areas, those checkpoints, and really determine what is the root cause of that.
Mm-hmm. Yeah, no, I agree. Everything you just said. And it's not as simple as here, this, and that. It's actually taking everything you have, putting it together, and along with the physical exam, and determining what could or could not be going on. Right. So no, you answered that perfectly.
Thank you.
All right, so here you go. This is what I was looking for. So this is an example one, like I do with my students, and for you all that are actually watching, this is something that the doctors may actually pull up in the top left-hand corner. So that's going to be your name, your age, your sex, the doctor name, reference number, all of that. There underneath that is your actual breakdown. That's what Dr. Coy was talking about. You had your reference, and then you had your optimal. So are y'all able to see this? Or I need to zoom in some more.
No, it's good.
So this is what you all will see. So anytime you get your blood drawn, you may actually see something like this. So can you all break this down?
Yeah, so if you're looking at it, you're looking at, the first thing I look at is the TSH. Mm-hmm. TSH is 3.3. I'm saying, all right, that's in the range I like, but I don't like that 0.3, but it's okay. Mm-hmm. Then I look at the lab to see what the lab has their reference range. I say, all right, it's 4.5, that's fine. Your free T4, it is, I think that's a 96 or a 98. So that's still that's to me in the middle. And then your free T3 was at 1.86. So overall, that looks normal to me. And if the patient's asymptomatic, I don't really do anything else. I just say, all right, it looks good. Let it be, unless they're having some other symptoms. Scroll down for me. What do you see? Oh, they're just showing patterns. Okay. So that particular lab work, I'm not seeing anything abnormal. It's just, it looks good to me. Mm-hmm. From what I'm seeing. Now, if the patient is saying that they are having some other issues or some kind of condition that's going on, that's when I would actually order some more lab work, some more detailed lab work to get an understanding of what's taking place.
Yeah, and that's the reason. That's the reason why you have to really look thoroughly at the labs, because most labs or most doctors will maybe run 3 to 4 markers, and for me, a patient is coming to me because they're having symptoms, sometimes even debilitating symptoms. And again, they're on medication and they're trying to figure out, well, my doctor is giving me this medication and my labs sometimes they come back normal, but I still feel like crap. Things are falling out of my head. I can't keep things. I have that brain fog. I have, issues with losing weight. So symptoms are really key. They're giving us a sign and a signal that the body is not balanced. Mm-hmm. And so when you run those labs, again, most doctors will run maybe 2 to 4 markers. I'm running 12 minimum on the thyroid because, again, that's the gas pedal. So, like a car, I mean, you can't operate without the gas pedal. You can't operate without that metabolism. And so there's a divine reason why that's occurring. So when you look at those labs, you always have to look at it from 2 vantage points. You got to look at it from the standpoint of, okay, well, this is the reference range, which is 2 standard deviations away from normal. is a very broad, you can drive a truck through that lab range, versus optimal. It's almost like school, you know, different schools have different grading systems, different curriculums. An A over here is not an A over here. Same thing with how you're interpreting your labs. And so the key is, if you're not getting a thorough panel, you know, you have to dig deeper, because again, what I see, majority of patients that come to me, they have a Hashimoto's thyroiditis, or they have an autoimmune condition. And even oftentimes, you know, this doctor would say that they're hyperthyroid, and that's just a point in time, and their symptom is showing, and they're showing and manifesting their symptoms in a certain way. Regardless, I still run those labs, and it comes up they still have Hashimoto's. So, you know, it's a very, very, very it's almost like I'm Sherlock Holmes, always trying to figure out, you know, what those triggers are. And these triggers can be, you know, just from your lifestyle, and the places that you've done, the things that you've done throughout your life that you haven't really gotten over. So these are things that we have to really take into consideration.
Yeah, and the other thing I like to do is that if the person is still symptomatic and I have them on medication, I have them on, let's say, the Synthroid, then I will like to adjust their Synthroid level a little bit to see what that perfect range is for them. Because like you always saying, it's optimal. What is the level? What is the range that the body likes to be in? And so that requires me to adjust their Synthroid level to see where we are and how much can we basically finagle or play around with it till you no longer have those symptoms. Mm-hmm. But also, if you're coming to me multiple times with the same complaint, then I know I'm missing something. So then I'm ordering more lab work, but I'm actually talk to probably my endocrinologist to help me out to see what am I missing. But for the most part, as an internal medicine provider, I try to do everything and get all the information together and gather it all and get all the data points before I reach out to a specialist, because I know I can figure it out. But if it gets to a point I got to tap out or just tag a friend or phone a friend, then I'm going to do that as well. But it does come down to the lab work, because the person is not crazy. Something is going on. It's just it's up to us as a medical community to get an idea of what's really going on. The other thing is, I like to figure out what's going on in the home. What's really going on in your home? Because if your home situation is not really a calming, comfortable environment, you should be able to go home and be able to relax and feel good. If you're going home and you're always uptight, that's going to let me know that you have your adrenal system revved up. That's going to affect your thyroid function. That's going to let me know that's going to be off. So I got to figure out the home situation along with just the medical situation. So whatever is at home plays an effect of when you come in to see me. So I got to get all that together and figure out what's truly affecting you.
Mm-hmm. Yeah, for sure. You have to look at the lifestyle.
I'm the only one that's playing doctor on here. Those are real doctors. I'm the YouTube doc.
Dr. Google.
There you go. Hey, you see, hey, that's why I'm a teacher. I facilitate. I'll pull up anything you need.
Hey man, you're doing a good job. I got to give you a shout out for it. You were pulling up the slides.
Yeah, you're great moderator. Yeah, great moderator. Keep up. We know what you're good at.
Hey, I stayed my lane.
So what else you got on the list, Eric?
Okay, now you're actually too much. I lost my place.
You give the compliment, and then he just fumbles the ball.
Hey, that's like the Ravens last night.
Oh my goodness.
Man. I was hoping for it. You come on, man. Mark, I need you to hold on to that ball. Hold on to that ball. He knocked it out.
Yeah.
We actually covered. Oh, we covered a lot. Hold on, let me pull it up. We covered a lot.
And I have, like, I don't know if I can be able to present something. Like, can I share my screen?
I don't know. Try. Does it say present?
Yes, present.
Okay. Hey, we're gonna find out today. Why are you laughing?
We're gonna figure out. Let me see. Share screen.
Hey, I know my position. I'm a teacher. I know my position.
Okay. Let's see. I don't know. Can I do this?
Okay.
I don't see anything popping up on this end.
Yeah, because I want to be able to. Let me see.
Oh, I can't even do settings. I look, that's beyond me.
No, I see that I can share, but go ahead and continue because I'm gonna figure this out. Because I want to show this one, like you're pulling up labs.
Mm-hmm.
I want to really show something that is really interesting because I deal with this on a day-to-day basis. But if there are other things, I know there's some other points that you had there we can talk about while I try to figure this out.
No, just here. We honestly, y'all hit it. What we covered, understanding thyroid, common thyroid diseases or disorders, symptoms to watch. We talked about that. We compared and contrast hyperthyroid versus hypothyroidism. So we did that part. Diagnosis, treatment, TSH, T3, T4. You broke it down, explained what exactly that meant. That definitely helps out. You talked about medication, lifestyle changes. Homestead was talking about being allergic to iodine, so you broke that down as well, which was definitely a good thing. Talked about thyroid and weight loss, the functions of it. You talked about pediatrics, and they will exercise, but they're still not losing weight. So you have to go back and look at the root cause. We talked about food as well. Then again, like I said, the iodine. Lifestyle tips for better thyroid function. That's honestly, that's what we hitting. That's what we hitting. So y'all doing it. Y'all doing it. Teppa said, yeah, I'm seriously fed up with doctors and debating if I'm going to try to change to another doctor. Honestly, if you don't have, they'll tell you. Ask them, to be honest with you. What are y'all saying? So you see this comment. I'm seriously fed up with doctors and debating if I'm going to try to change to another doctor here. What do you think? What do you say about that? Y'all doctors, what do you say?
Go ahead, Coy. I'll let you take it.
Yeah, I mean, I that's where my practice exists for that very reason, to be honest, because I've seen patients really suffer from this, and this even links up with type 2 diabetes. That and again, I've seen this in males too. So there are males that are going around having issues with weight loss. They're having issues with low libido. We think that these things are just, we're just getting old and we're declining and all those things there. We get that belly fat and indestructible belly fat that never goes away. It's like concrete. But really for guys, it's really the bedroom, to be honest. Like when they're having issues with erectile dysfunction, and they're having problems with performing, that's the thing that gets us going. Like, oh my God, I lost it.
Yep. No guy will see a doctor until,
right,
this ain't working no more.
This ain't working.
We gotta see. Yep.
But the thing is, it's like at that point, these are aspects that are actually really dangerous, because these are signs of chronic inflammation, that the body is actually slowing down, so that, we've heard issues with guys reaching for the blue pill because they have that erectile dysfunction, and they'll have a heart attack having sex, right? And that's not what the body is going to want, to slow you down versus trying to speed you up to premature death. And so these symptoms that we ignore, we'll have issues with brain fog as well, and all these other factors. We have to really address that. But I think I figured out the share screen here. So let me share this. Let me share. Can I do this? Can I do it? Yes. Can you guys see this?
Nope.
No. Oh my gosh.
Oh, hold on. I got you.
You got me?
There I go.
Okay. So this is a lab. This is a specialized test that I've run on my patients, and I blotted out the patient's name and all that good stuff just to protect them. But this is a Vibrant America, Vibrant wellness test, and it talks about toxins and how the toxins. This patient, actually, I'm treating, she has Hashimoto's thyroiditis. And again, just give you a little bit more background on her. She did not she was fed up with the medical community. She was fed up with just having issues with cognitive acuity. You know, she was having issues with energy. I mean, just want to stay in bed all day. And yet she has grandkids. She takes care of. She watches and takes to school and helps with her family. So she's very active. And so, you know, when we look at this specialized tests, we look at what's called a total tox burden. We look at these issues here. So if you take a look here, you know, the total toxins, we're looking at toxins, mycotoxins like mold. We're looking at heavy metals and also environmental toxins. These toxins are the triggers that inhibit a person from having proper thyroid function. And if you can see here, all the stuff in the red, it's crazy. Like you see all these markers here in the red. These are toxins. These are mycotoxins. These are heavy metals. These are environmental toxins. And here's a few suboptimal markers. This is a 27-page document that shows all the toxins that are wrong with this patient. And so, not to go through this, but I just wanted to really drive the point home that when a person is having thyroid issues, the thyroid is not the problem. It's the victim of other issues that the body, like these, that the body is having these issues. So to Dr. Whiteside's point, yeah, you got to look at the home. So if you look at the home, for instance, you know, if you look at this aflatoxin right here, these are multiple aflatoxins. You see these other ones with this little symbol here. That's mold in a person's house. Water damage building materials. Majority of these come from that. But that just gives you the tip of the iceberg. And when you see this, no wonder a person is having brain function issues. No wonder the person is not able to lose weight, because these are obesitogens. These actually create inflammation, and they create the body. The body's trying to protect itself by holding on to the excess weight. Look at this: uranium, tungsten. I mean, this person all these are heavy metals that you know, that don't get eliminated, don't pass that blood-brain barrier to get out of the system. And a lot of these things where a person has a genetic predisposition to not allow them to recognize these things and or get rid of them. Yep. So this is what makes my job really fun, because it's fun because I get to really dig deep, you know, and I have to empathize with a lot of the medical doctors. And I used to be the one that was like, man, forget these doctors. The doctors don't know what they're doing, blah, 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 blah. And to be honest with you, they're human too. And they're going off of what they've learned, and they're going off of a lot of times limited information, right? So if they are just in their box, they're going to do what they are going to do, right? And then if the patient is, you know, thinking that the insurance is going to save them, that's a whole nother box that you're tied to, right? So what ends up happening is this tug of war where, you know, the insurance is going to pay for certain things. And to be honest with you, like my wife is a physician, and she puts it plainly. She says, well, insurance is not going to pay your car insurance, for instance. Your car insurance is not going to pay for your oil change. Your car insurance is not going to pay for keeping your tires inflated, rotating your tires. That's on you, right? And your insurance is really there just in case something happens, something big happens. And thank goodness if you have a good health insurance plan, that you have that there. But when it comes down to day-to-day issues like these toxins that the body, like this is an example. The insurance company is gonna want to pay for that. They're not in business to help you to cure the issue. they're there to help save your life. They're there to keep your vitality up, but they're not there to help save your life. But then when a person is struggling day in and day out with symptoms and issues, and they're not feeling well, and they're on antidepressants because their doctor said it's all in their head, this is what we have to cut to the chase and really get to the root cause. And that's just one example. There's one test that gives you a whole host of information. And there's other tests that I have to do also to put all those puzzle pieces together to help shift the narrative to say, yeah, all right, this is the issues. Let's go ahead and remove that. Let's get the body strong enough to be able to release and bind and eliminate these toxins.
Yeah. So let me go back. Tampa Creek, you were talking about you seriously fed up with the doctors. The thing is that you got to find which one relates or you can relate to best. So your insurance companies will say, these are your list of your doctors that are in network that you can see. Now it's almost as if you're on a dating app and you got to go match. Okay, do I match with this doctor? Do I match with that one? And that's the issue, is that if I said it a long time ago, if you're not comfortable with your physician, you're not going to tell them a lot of stuff, him or her. You're going to keep quiet on some of the things because you're not at that level of comfort. For my patients that come in, even the ones I met for the first time, I have a very common environment. And then also I have more of a very common demeanor. So when a patient's coming in, I'm already knowing that they're going to feel pressure. They're going to feel rushed. They're going to think, oh, I'm here. I'm just going to be bad news. My job is to get to know you. I want to get to know you. And then that way I can figure out, okay, how do we interact? How do we get you taken care of? Because I want to make sure you're taken care of. People will tell you, in my clinic, I crack a lot of jokes. I have fun. I lighten the mood because I need you to be comfortable, but also I need to be comfortable, but also want my patient to know I am human, because people will put these physicians on a pedestal. And come on, we put our pants on one leg at a time, just like everybody else. The only difference is that we went to medical school. That's really the only difference, but we are still human. So as a human, we got to get to know who you are as a person, just like you got to get to know who I am. My patients know me. They know about my kids. They know what I do when I go home, have fun. Because I want to build that repertoire with them. I want them to understand I'm normal, and I can't say I have bad days. I have good days and I have better days for me, but I let my patients know I'm here to take care of you. Homesteader said, why is it so hard to lose weight when you have a thyroid problem? Dr. Coy said it earlier, and it's just that the thyroid is really, it controls the metabolism of the body. Mm-hmm. And when the thyroid is functioning abnormal, that causes really chaos downstream. And so either you will or will not lose weight depending on which way the thyroid is functioning.
Yeah, I mean, and the piggyback on what you're saying, Doc, about, trying to find that right match, at the end of the day, as well, it comes back down to results for me. It comes back down to results, that you are looking for the proper results. You're looking for improvement. You're looking for some type of change. You're looking for a change in your function. Those symptoms, again, they're there to stimulate a signal for you to investigate the why that is happening, not what it is, but why, right? And that's the step that if the doctor has no interest in getting to the why, that may be,
not good.
That may be a deal breaker with you, right? And again, there's a time and place for medication. There's a time and place for certain types of procedures, but with a thyroid, you have to play it very. You have to be very smart about it and be very strategic, because I've seen thyroid glands being removed, and it didn't need to be removed. They've been told that, hey, this can be cancerous. Yeah, you got the goiter and all those things, but again, majority of goiters are not cancerous. Correct. That's just a manifestation of the inflammation that's there, or it's actually showing that, hey, you got an autoimmune condition. It's not cancer. I've had patients that they've removed the thyroid, and then after the fact, they go back and say, oh yeah, sorry, it's not cancerous.
Correct. Yep.
And then, oh, now you have to be on all these medications. So, there's all these factors that come about from that. And it's just, you have to get all sides of the argument and all sides of the condition. And for me, patients have already been through it, and they're finally coming in and saying, you know what, it's the answer and the results are not happening over there. This is what I want. I want a more holistic approach. I want a person that's really going to really investigate. I'm willing to do whatever it takes because I've tried this, I've tried that. I feel like crap. And when we get to the root, I mean, one of my patients lost 70 pounds without exercise. Yes, we got the diet together. Yes, we removed those toxins. And I saw that question come across. Well, how do you get rid of the toxins? Well, there's for that person, we have to look at those factors and where those toxins are coming from, the source of where those toxins are coming from. And let me just put this out there. Those are the toxins that patient is releasing. Those are the toxins that person is releasing now. So we had to get that person to a point where that person is releasing it to see it.
Mm-hmm.
Right? And then we go through their treatment and keep pulling those toxins out of the system. So just imagine a person has had thyroid issues for years upon years, 20, 30 years. And, then we start looking at, okay, where did we live? The food that we ate, the stresses that our body took. I had a patient today. She was like, man, I didn't know this was a mental exercise because I'm now going backward, following the breadcrumbs all the way back to see how this started. So,
yeah. And then, what was it? Can you pull it up, Eric? Tampa Creek was saying, oh, I'm so overtaking meds. I've been looking more into herbal medicine, good and bad. And I say that as in, so there are certain medications, especially herbal meds, that actually will have a negative impact on our life. But TVs will sell it or ads will sell it saying, oh, this is the game changer. You should take this and that. That's not necessarily true. If you talk to anybody, I would say it is a holistic doctor, an herbalist, and just kind of get to know what they're talking about and sit down and get to understand what will help with different things in the body. Mm-hmm. Yes, any medicine you take from a Western physician, they prescribe a medicine, everything comes with a side effect. Mm-hmm. I let all my patients know. So my goal is to take them off as many meds as possible. That's to keep them healthy and well within reason. Now, there are some meds that the patient just has to be on that. I tell them, you're going to be on this for life, and this is why. I like patient understand why they're going to be on a specific medication. But there are some meds I can take them off of. I said, no, let's see if we can get you off this medication. Let's try this. Let's do this. Let's do that. And I always say, give me a timeline of 3 months. Give me a timeline of 6 months. Because I want patients to understand, realistically, it takes time for the body to adjust to whatever we're doing. So you're not going to see this microwave change within a couple of days. You're going to see slow adjustments and improvement within 3 months, within 6 months. And then I'll tell a patient, if I haven't gotten them in there or I'm still not there, I will explain to them, listen, we're not there yet. This is what I'm still looking at. I asked you to give me this amount of time. If you're okay, I still need a little bit more time to get you to where you need to be. But I make it a group effort, a team effort. I want the patient to work with me, and I want to be able to work with the patient, and we set realistic goals.
Okay, gotcha.
All right, so that's great. We got to wrap it up because we're well over an hour. We do apologize. It just got real good. We wanted to make sure you all got a lot of good information. Sassy talking about, do you have to be on Thyroid for life? Or are there natural alternatives? So that's the question. So do you have to be on Thyroid for life or medications for life? Or are there actually natural alternatives for that?
Yeah, there are natural alternatives, but again, you have to look at what are the triggers of your thyroid issue and have to do it very strategically. There are naturally desiccated thyroid supplements out there. Biothroid is one, and there are numerous other factors, numerous other natural desiccated thyroid hormones, replacement hormones that are there. But again, you have to have a practitioner that is well versed in that. The same way that you can swing all medication, you can go the same way with herbs and all these supplements and things of that nature, and just try to treat a symptom without really looking at the root. So I look at those things like the medications, or even, some of these natural desiccated thyroid issues or thyroid supplements are there to help stabilize the situation while you continue to figure out the root issue. Because like I said, when you're taking these things to stabilize you, but if you're ignoring the root, you're still going to come back to square one way or another. The body's going to compensate one way or another. So it's good to make sure that you have a practitioner that's well versed in the condition and understands where the root is coming from.
And the other thing, if the practitioner is not well versed, have a practitioner that's willing to learn. That's the other thing, because you'll meet some practitioners that says, no, let's just stick with this medicine. Yes, you got to be on it for life. There are some people where I've tried everything I can. They came in with supplements. It didn't work. I checked their thyroid levels. It was actually going haywire. I put them back on Synthroid and say, listen, we're going to be on Synthroid because we still couldn't figure out the underlying cause. Let's stay on this. Let's still continue to dig through, figure out what's going on. Like Dr. Coy said, your insurance companies are not going to pay for a lot of these labs. So the labs that he's able to order, most of it's out of pocket. If you want your insurance to cover it, they're going to get denied. Maybe some of the metals, because I have been able to run some of the heavy metals, but not that detail of a panel, because literally the insurance company is not willing to fork over the money to really see what's going on and get you taken care of. Right. And they want to do preventive medicine. That was the biggest thing, which I like. It used to be reactive medicine. Now it's preventive medicine. So that's good. So the medical community is coming around, but it is taking a long time to get to where we need to be.
Yeah. And for me, and I guess my closing argument or closing statement here is, pay attention to your symptoms, pay close attention to them, because they are signals. And one of the things that is very rewarding for me when we get to the root cause, a lot of times the labs still look haywire, but the symptoms get better because we're addressing the root, the real problem. And unfortunately, when we see what we're trying to do is really slow down the destruction of the thyroid, because that's basically what autoimmune thyroid is, that Hashimoto's is. The body is really trying to make it smaller. It's trying to destroy it, to bring down that metabolism. So my main goal is, hey, let's stop the destruction so that it doesn't become a bigger issue like thyroid cancer. Let's slow down the destruction so that it doesn't get to the point where you have to remove it. And so it's always important to get to the root, no matter what that symptom is. You gotta really manage that symptom and address the triggers that's driving that symptom and driving those labs to be where they are.
Yeah. Now, hey, Eric, I see one thing. Tampa Creek talked about blood pressure. Hey, if you down with it, let's hit that next month in February, since it's heart health. And so blood pressure and heart all correlate. So let's dive into that.
I love it.
All right, cool. I ain't got no problem with that. All right, so we're going on an hour. I'm gonna say a minute. Going an hour and 28 minutes. So I don't want to hold you up anymore. It was a great live. So for this, if you take a look at the screen, that's what we talk about. Thyroid disorder affects millions of people worldwide, but many remain undiagnosed. Whether you're living with a thyroid condition, suspect you may have one, or simply want to maintain a healthy lifestyle, this live session was packed with practical advice and evidence-based strategies to help you understand and manage your thyroid health. That was one of the biggest things for us and a doctor, is to actually make sure you're advocating for your health. That's one of the biggest things we do. We want you to advocate for your health. And I hope you got a lot of good information from here. The takeaways, like we stated earlier, a clear understanding of how the thyroid works. We showed pictures of that and where the thyroid is located, right below the neck, or right in the neck area, butterfly shape. Knowledge of common thyroid disorders and their treatments, practical tips for managing symptoms and supporting thyroid health, and confidence. Again, confidence to advocate for your health and seek the care you need. So if you don't like that doctor, roll on with the next one. Find one that is suitable for you. I'm just gonna be honest. You paying for it. Find one that's suitable for you and that's willing to learn. If they're not willing to learn, roll on to the next one. That's how it goes. Roll on to the next one. Any parting words for you all?
No, I have none. Thanks, Cole. I like it. We covered a lot, man.
That's a lot. I mean, this is a very complex topic, but getting to the basics of it, and again, just trying to make it applicable to each and every person here. I hope everybody was able to glean some good information. For me, is hey, if you're looking to get to the root cause, get to the real problem. That's why my practice exists. Is that we got to get to the root. We have to understand that the symptoms are there to help you to signal that, hey, the body's not balanced. Let's get to the root of it. Let's get to the real cause. And that's where the magic happens. You're able to reverse a lot of these symptoms. You're able to have the vitality that you've missed for many years, have that energy, lose weight without exercise, and not have to be on fad diets and all these crazy things that you see on the internet. The key is just getting to the root of it.
Homesteader was asking, do either you do telemed?
Yes.
Corey, that's for you.
That's me.
Yeah.
So I think my information is on the chat there. I do offer consultations. My staff, my office, we do offer 30-minute consults that are free, but you have to be serious. This is not just to fiddle around. If you're looking at really diving deep and get to the root cause, you can reach out to my staff here, and even if you would like to have a consultation, it is my phone number is 954-637-2990. That's 954-637-2990. Feel free to text us if you would like to have a consultation. Koi Wellness Solutions. That's Koi, like the fish, KOI, Wellness Solutions, on social media, Facebook, as well as our web address, koiwellnesssolutions.com. And we'd be more than happy. Free.
Yes, Mario. Yes.
It's always in the budget.
Free consultation. But again, this is, my time is very limited. I do webinars and all these things, but extend my time just to educate. But at the end of the day, I'm all about results. I want to be able to get to the root. And if it's serious enough, then we'll be willing to offer that. And I have my admissions director will take you through that process to really look to dig deep and to figure out the root.
Hey, thank you, Ashley. All right, so hopefully everybody learned something. I definitely hope everybody learned something. Like, comment, subscribe, like everybody else say. Like, comment, subscribe. If you found this live to be beneficial, we do have other lives. We have more coming up as well. So please make sure to join us. Hit that bell notification. That way you be up to date on all the latest and greatest, like everybody else said. Today was talking about thyroid and thyroid issues. Previous to that, we were talking about weight loss. And next week, we're going to not next week, in 2 weeks, we're going to hit what again?
We're hitting the heart. We're hitting the blood pressure. Hitting the blood pressure, man.
Yep, hitting all that, because February is Heart Month. And that's very important because we just got a notice from one of our frat brothers. He's about to have a triple bypass surgery.
Wow.
And he's our age. It was like, come on now. And so that was very interesting to be about 47, 48, 49, so around there, and have triple bypass at such a young age. And that's very interesting. So we're definitely going to hit the heart and make sure everybody has a good understanding of that. If there's other information that you want us, or other things you want us to go over, send us a message. We're on Instagram, we're on YouTube, so we're on TikTok, but that's more for social. So we're on Instagram. Pretty much majority of stuff is on Instagram and YouTube. So hit us hard, ask your questions. We're not the gatekeepers. You ask, we're gonna tell you. I'm just gonna let you know. It may not be something you want to hear, but we're gonna tell you the truth. That we're not sugarcoating anything. We're gonna go straight to it. Like I say, Koi is available for a telemed. So if you're serious about it, hit them up as well. There's no other questions, comments, concerns. We're going to actually end this lab with an hour and 33 minutes. Thank you all so much, and we catch you all on the next one.
All right, salute.
Happy MLK.
Yes.